to start off, ocular surface disease in glaucoma. I have no financial interest in this presentation, and so we all know what dry eye is, and here what we are concerned about dry eye is the pharmacological aspect of it. The dry eye caused due to anti-glaucoma medications. So the prevalence of ocular surface disease in patients with glaucoma, studies have been done, and the two major studies are Lewin et al. And Fechner et al., who conducted the studies in several centers. So the prevalence of OSD in patients with glaucoma, the study designed quite a large number of patients, 101 patients. This is the study done by Lewin et al. And the exclusions were receiving cyclosporine steroid topical ocular non-steroidal anti-inflammatory drugs or punctal plugs within previous 3 months. And what they did was ocular surface disease index, the Scheimer test, staining with fluorescent and lysamine green, and the tear film breakup time. And this is what they actually found when the normal, mild to moderate and severe, and these were the numbers which actually fell into these categories. And that's a bar diagram to show you the normal in blue and the normal in green with lysamine staining, Scheimer, and the tear film breakup time, the signs versus symptoms in OSD. So if you look at this, you find that 59% of those using anti-glaucoma medications had mild to moderate severe ocular surface disease, which is really a very high number. And again, to come to the Fechner study, which was conducted at 10 sites, very well distributed geographically, and there were 630 patients, and these were the conditions which they met. And they completed the survey while in the office, and this is how the grading was done again, mild, moderate and severe. And if you look at this, just the prevalence of dry eye, they found that it increases significantly with age, and they also found that prevalence of dry eye is higher in women than in men. So next we have these studies done by various authors. Our very own Ramakrishna et al. Found 2.6% of prevalence, and these are the studies done outside our country, and again we have another 4.74% done by Varma et al. So if you have a look at this glaucoma and dry eye, if you say G1 is for if a patient is using a single drop, G2 for 2 drops, G3 for 3 drops, and they had 20 controls non-glaucoma patients. And when they did the study, they found that G1 had 11% of the G1 patients had dry eye, 39% of the G2 patients had dry eye, and 40% of the G3 patients had dry eye. So the number of drops, as you increase, the dry eye increases. Next we move on to the prevalence of OSD in patients with glaucoma treated with topical medications. The study results, here they found the Fechner et al. Result. The other one was over 50%. This is about 48.4%. So it's almost very close, both of them. Now, what does this dry eye come from? It's actually from the preservatives which are there in these anti-glaucoma drugs. Most of them have detergents, and the culprit here is bark, as you all know. So bark is often used in disodium ether. It interferes with superficial lipid layer and reduces the tear film breakup time and can accumulate within the epithelial cells. It arrests the conjunctival cell growth and causes death. And if you're giving your patient more than 6 drops over a period of say 4 to 6 weeks, then it definitely will have toxic effects, and it is absorbed by contact lenses. So this is what bark actually does. If you compare these two pictures, this is when it's been used 4 times a day, and this is when it has been used 6 times a day. So it causes apoptosis of the goblet cells and finally cell necrosis. So what about the other preservatives? We have polyquat, which is similar to bark but has lesser toxicity, and then we have thimerosal, which is causes cellular retraction, cessation of mitotic activity, and superficial epithelial cell loss. Then we have the chlorobutol, which is relatively safer, but it also does have toxic effects. It inhibits the oxidation of oxygen by the cornea, which is one of the major problems. And finally, we have the oxidative preservatives, which are the best actually. Purite, and it's sodium chloride, So sodium chlorate is converted into chlorine dioxide when exposed to long wavelengths of light. So that's when we say when you give the drop, it actually becomes water. So salt and water. So this is how actually sodium perborate acts. And finally, this is the ocular surface. It breaks down into water and oxygen. And these are the changes that you would see in a normal rabbit cornea if you were using. So just look at this with polyquat. That's the normal rabbit cornea. This is with sodium perborate, and that's with Purite. So this is closest to the normal cornea. So sodium perborate and Purite are called the noble preservatives, and both of them offer attractive options as preservative in multi-dose vials. So they can be used more than 6 times a day. They're important for if your patient is using it long term, and anti-glaucoma medications are used long term. And so the 5 steps to risk assessment are basically age and gender. You need to consider both. That with aging patients, you need to be more careful, and more careful with women. Comorbid conditions, which my following speaker would speak in detail about. Then glaucoma itself actually causes dry eye. And then you have glaucoma medications, bark-containing drops, which we just spoke about in detail. And glaucoma surgery also causes dry eye. So dry eye in glaucoma patients itself may trigger dry eye, just as I told you now. And these are the percentages: 22% in non-treated PAOG versus ocular hypertensives, and 27% in non-treated PAOG versus normal controls. That's the percentage. And the possible reason is autonomous nervous system dysfunction. That could be IOP, intraocular perfusion, and tear production are subject to neuronal control and get reduced in glaucoma. So what happens when you overload your patient with drugs? So these are basically the inferences drawn from the studies which I just spoke to you about, and therefore a preservative-free or bark alternative is a great option for treating patients with glaucoma. And when evaluating patients, comfort and quality of life are of utmost importance in the treatment regime, because non-compliance can produce a host of problems, and most worrisome being glaucoma progression due to lack of treatment efficiency, which Dr. Kamar will be talking to you about. And so if you look at these glaucoma medications, just look at this list. The lone survivor here actually is Alpha-Gen Z. The rest, all of them contain BAC, and I have no financial interest in this chart. So after filtering surgery, yes, we again have tear film breakup time decreases, and there's less sweating with large hanging blebs. If you're using MMC, it may cause damage to the conjunctival goblet cells, and that's how you can have dry eye as well. You need to keep those in mind when you're treating glaucoma patient medical management. And if you compare dry eye and glaucoma, both are chronic diseases of the elderly. Both are more prevalent with age and with women. Both have impact on ocular surface directly or indirectly. And they are chronic topical therapy, epithelial toxicity and inflammation, filtration blebs, which we've just spoken about, use of MMC, and tubes and shunts. So when you see these pictures in your office next time you're seeing a glaucoma patient, the stress doodles, and you see an eye like this, but the pressure is still under control, you actually need to give it a good thought. So signs and symptoms of dry eye often are under-recognized in glaucoma patients, and in every glaucoma patient, give importance to the symptoms when the patient comes and says that there's a foreign body sensation, there's tearing, please give importance to it. Look for the signs of dry eye, perform some of the tests, at least maybe you can do a Scheimer test in the clinic or a plasmine green, and detect at an early level. So consider both while making therapeutic decisions, and minimize exposure to BAC and other preservatives. Nowadays we have a lot of preservative-free drugs available in the market. So dry eye and glaucoma, both are very similar in that we need to improve the awareness. Medication needs to be reviewed, and glaucoma and dry eye itself actually can cause dry eye. So my message to you would be increase awareness around ocular surface disease and glaucoma, and thank you very much for your attention.